everyone, and welcome to CHD Group's 7th Foundation Day Forum. Today is all about uncovering public health and reclaiming gains for accelerating global health. First, let me introduce myself. My name is Dr. Demi from CHD Group, and I'll be your moderator for today. If you would like more information about the presentation and biography, you can access our website at chdgroup.org. Before we get started, I'm going to go through some housekeeping to ensure you can interact with myself and the speakers. If you wish to ask the speakers a question or if you experience any issues in hearing today's webinar, please comment the same from your platform. For the speakers, please note you will be brought in live for your address, post which you will be at the backstage. Kindly do not delink until the webinar concludes, since we'll be running the Q&A at the end of the webinar. Thank you. Now let us have the pleasure of listening to the opening remarks. May I request Dr. Edmund Fernandez to deliver the welcome address. Dr. Edmund Fernandez is the founder and CEO for CHD Group. He is also a non-resident senior fellow of the Atlantic Council and the US State Department alumni. He is a member Health Task Force DDMA, Government of Karnataka. Dr. Edmund has authored 2 books, got over 18 research publications related to global health and humanitarian emergencies. Over to you, Dr. Edmund.
A very good evening to one and all within India and around the world. 7 years is a long time in the life of any individual. And today, CHD Group turns 7. Amidst all our struggles and stories, we've made it through. I would like to take this opportunity to thank each one of you in every corner of the world who has helped us in kind and in cash, in faith and in spirits. It's because of you our story continues to be written, and with quality, transparency, accountability, and impact. I would also like to thank the members of our governing board, the advisory council, CHD distinguished fellows, our working committee, and our stakeholders, most importantly, our donors. It's been a great privilege so far. On the same note, the COVID-19 pandemic has transformed our world in unprecedented ways. The race to 2030's Sustainable Development Goals now stand questioned. What did we achieve till now? And whatever we have achieved till now, would it be a watershed moment in world history? This is our time to tell another story to each and every public health professional around the world, to redefine that very spirit that brings us together and see how we could really address global health issues in a post-COVID world. Without taking much time, I would like to leave this to our erudite scholars who would talk authoritatively on issues and concerns of global health in their very settings, in their geographies, around the world. To the spirit of One Health, let us come together to nurture a healthy world. Thank you very much, and thank you for being with us today. My pleasure and gratitude. Demi, you can't be heard. You're on mute.
I'm so sorry. Thank you very much, Dr. Edmund. I would now like to welcome our speakers for today. Firstly, I request Dr. Yogan Pillai to address our esteemed participants. Deputy Director for Clinton Health Access Initiative, South Africa, Senior Global Director for Universal Health Coverage. He has also served as Deputy Director General for Health Programs in South Africa's National Department of Health. Prior to that, he served the Department of Health in various roles, including Chief Director for Strategic Planning and Director for the District Health System. Under his leadership, South Africa's immunization program expanded to include 3 new vaccines: rotavirus, pneumococcus, and human papillomavirus. He is responsible for policy making, guiding implementation, and monitoring of national programs in HIV, TB, maternal and child and women's health. He has contributed to a large number of journal articles, including co-authorship of papers on financing of HIV and AIDS programs and drug-resistant TB. He is a co-author of the textbook of International Health, Global Health in a Dynamic World. CHD Group is glad to have Dr. Yogan Pillai to share his insights on reclaiming gains to accelerate global health. Over to you, Doctor.
Dr. Demi, thank you very much for that kind introduction. It is indeed my privilege and honor to speak at this very important global health dialogue on reclaiming gains for accelerating global health. And I wish to thank Dr. Edmund for his very kind invitation. My co-authors and I dedicated the last edition of our textbook on global health to all those rocking the boat for health and social justice across the world. I salute the CHD Group for rocking the boat this afternoon. Indeed, as Dr. Edmonds suggested, the COVID-19 pandemic means we can never be the same again as a global community. But it's very important for us to ensure that we do not waste this very important moment in humanity's history. In the introduction to the global health textbook that I mentioned, that I co-wrote with Anne-Emmanuel Byrne and Tim Holtz, we note that, and I quote, global health is not simply a matter of emerging diseases or epidemic threats. And I think we can add now with COVID, with pandemic threats. Virtually every crisis has global health implications, affecting up to hundreds of millions of people, whether related to financial collapse, precarious employment, wars and displacement, ecological disasters, climate change, or any other catastrophe, including due to political instability, social insecurity, and dismantling of social infrastructure, such as healthcare services. In terms of current trends, I would like to add to this list that I just quoted from the textbook of global health. And I'd like to add racism, colonialism, and the need for global solidarity. This is precisely why we need a more wide-ranging debate on global health. However, the key question is, how does one tackle a topic as wide-ranging as this? One way of thinking about it is to focus on social protection. According to the International Labour Organization, social protection is the compelling issue of our time, and I quote, social protection is both a human right and sound economic policy. And I think often when health professionals speak about global health, people outside the profession do not consider global health to be contributing to the global economy. And I think the time has come for us to be able to put forward ideas of how global health and the global economy are linked. And I dare say the current COVID-19 pandemic has shown us this more clearly than most others. The ILO continues to suggest that social protection powerfully contributes to reducing poverty, exclusion, and inequality while enhancing political stability and social cohesion. And I quote, the 2019, 2020, 2021 period has reminded us really of our interconnectedness. The COVID-19 pandemic must force us to embrace the notion of global solidarity. Pre-2019, and I say 2020, global health was concerned, at least in terms of multilateral organizations, was concerned about global health security. And I think the global pandemic has forced us to rethink global health security and include global health solidarity. Given that most low and middle income countries were left behind in the race to vaccinate the majority of our populations, we clearly need to find ways from the global south to lead global health. And I therefore welcome this global health dialogue as one way and one contribution to this initiative from the Global South. This means that the Global South must work more collaboratively across a range of global health issues based on a set of defining principles to reclaim gains for accelerating global health, which is the theme of this global health dialogue. One set of principles is outlined by Booth and Ferreira, writing from Brazil, and includes the following: a move away from vertical disease-focused interventions to comprehensive development and thus strengthening of the health system, both national and global health systems. An emphasis on long-term instead of short-term needs, that is, by strengthening key institutions to acquire true leadership, promoting the development of a future-oriented agenda, and balancing specific actions with the generation of knowledge. 3, to move away from programs based on a single global orientation towards strategic planning centered on the reality of the recipient country by broadly incorporating the social determinants of health. And I might add, we need to go further than the social determinants of health and also consider the impact of the commercial determinants of health. And we see this critically in the context of nutrition, poor nutrition, undernutrition, and obesity. And fourthly, a prioritization of population-based or public health-oriented programs and activities strictly focused on individuals. Friends, there is much work to be done in each country, in each region, and in the global south, and across the global south to strengthen global health solidarity. We can and we must do more to ensure that we can live in a more equitable, a safer, and a kinder world. I thank you very much for this really unique opportunity and wish us all fruitful deliberations and a commitment to further collaborate with each other as we move towards accelerating global health. I thank you very much for this opportunity and for your attention.
Thank you, Dr. Pillai, for your words of wisdom. Your session was full of enthusiasm and valuable knowledge. Thank you once again, sir. Let us now have the pleasure of listening to the second speaker of the day, Chiara Menchese. She is an architect and urban planner specialized in urban theory and resilience. She has worked for a few years with the United Nations Office for Disaster Risk Reduction, handling several national projects in Europe and Central Asia, ranging from national scale. She's currently working for the CIMA, an Italian non-profit research organization active in the fields of civil protection, early warning systems, disaster risk reduction, climate change adaptation, and biodiversity conservation. CHD Group is glad to have Chiara to share her insights in pandemics, disasters, and climate change, a changing world. Over to you.
Good afternoon, everyone, and many thanks for today's invitation. It's really a pleasure and a honor. My name is Chiara Menchese, and as I was kindly introduced, I'm also a urban theory researcher and disaster risk reduction specialist with experiences with the private sector, UN, NGO. And today I would like to talk about the nexus between the COVID-19 pandemic, climate change, and the systemic risk umbrella under which they all fall. Systemic risk is made of and compounded by the potential for losses to cascade across interconnected socioeconomic and environmental systems. Losses can cross political borders and irreversibly breach system boundaries while imposing intolerable burdens on entire countries. COVID-19 seems inescapable not to start from here. We know how it started, or better to say, we all know now something that 1 year ago, just some specialists did know. The spread of viral disease is fueled by the globalization of trade and travel, intensive farm settings, which helps viruses present in the animals to jump the species barrier, causing the arose of pathogens such as Ebola, HIV, the West Nile virus, SARS, MERS, and COVID-19 as the most recent result of zoonotic transmission from wild animals. Many of the root causes of climate change also increase the risk of pandemics. Deforestation, which occurs mostly for agricultural purposes, is the largest cause of habitat loss worldwide, and we know that a loss of habitat forces animals to migrate and potentially contact other animals or people and therefore share germs. For this, a solution seems easy to identify. Less demand for animal meat and more sustainable animal husbandry could decrease emerging infections and also lower greenhouse gas emissions. But what if to this picture we add another element or two? Climate change and multi-hazard scenarios, what in two words could be referred as to systemic risk. Climate change reduces biodiversity and directly and indirectly intensifies the global burden of disease. It is also exacerbating natural hazards. And notably, over the last decade, almost all of disasters were triggered by natural hazards, caused by extreme weather and climate-related events. During 2020, many places and population had to confront both a COVID-19 crisis and the catastrophic condition of natural hazards. And we know that a future of warmer weather, more and increasingly catastrophic meteorological disaster, and potentially more pandemics call for global governance to address systemic risk and multi-hazards events. So the recovery phase in the pandemic is an opportunity to increase efforts to achieve sustainability goals and alternative development approaches. Coherent laws and policies reforms should be enacted to increase resilience to climate hazards that will also increase resilience to disaster risks and their cascading impacts. Without renewed commitment and increased investment post-pandemic, years of progress could be lost, and all national governments should devote a portion of their resources deployed for economic recovery from the pandemic to climate change resiliency and mitigation. Under this perspective, pandemic preparedness should be now mainstreamed into national, but also especially local disaster preparedness, contingency planning, and risk reduction strategy, with a focus on addressing cascading risks, systemic risks. There is a need for coordinated strategies and actions, as well as increased investments to prevent biological hazards and their impact on public health. The pandemic revealed the importance of interdependence between countries. OECD underscored the advantages of cooperation across regions in addressing systemic and transboundary risks for minimizing disjointed response and competition for resources, while allowing collaborative procurement and mutually supportive strategies. This change of habit would create a coherent response and recovery process across territories, experiences the impact of natural hazards, health risks, and climate challenges. Lastly, to build back better in the name of resilience, circularity, green economy, the full participation of cities and their citizens is needed. Therefore, it is crucial that the role of municipalities is included or elevated in international and other multilateral discussions and cooperative recovery efforts. Finally, I would like to raise the attention to the next pandemic without vaccine to cure it: drought. Water scarcity and drought are set to wreak damage on a scale to rival the COVID-19 pandemic, with risks growing rapidly as global temperatures rise. This according to the latest United Nations for Disaster Risk Reductions report. So global warming has now intensified droughts in Southern Europe, Western Africa, and the number of victims is set to grow dramatically unless the world acts. And it's not with discouragement that I say this, but with the proactiveness that such alerts should impose on us. To act, raise awareness, embodying the change starting from our daily life, and then escalate that change to a bigger scale. Thank you very much.
Thank you, Chiara, for sharing your deep knowledge with us. Your session was full of enthusiasm, valuable knowledge. May I now request the next distinguished speaker, Dr. Fatima Razay, to address our participants of the international webinar. Dr. Fatima Razay is an assistant professor at Isfahan University of Medical Sciences, Iran, holding a PhD in health and disasters. She has been a lecturer in management and entrepreneurship courses for medical engineering at the Jahad Higher Education Institute and is the country representative of CHD Group in Iran. CHD Group is glad to have Dr. Fatima Razay to share her insights on coping with crisis, perspectives from Iran for sustainable development. Over to you, Doctor.
Shall I share my screen?
Yes, Doctor.
Is it visible?
It is not visible.
I have shared it. I hope it's good.
Yes, it is
Is it
visible.
visible now?
Uh,
I think it's visible now because
yes, it is visible.
okay. Hello to all of the participants, and thank you for executives for these webinars, valuable webinars. I'm going to speak and discuss about Iran coping strategies in the COVID-19 pandemic. Uh, the first topic that I'm going to discuss about it is engagement and role of the community-based organization, risk communication procedures that we have applied during the COVID-19 pandemic, and follow chart for returning back to the work and screening pathways and vaccinations program in Iran. First of all, it's important to know that community-based organization and non-governmental organization have active participation in Iran in disinfecting cities and also production of face masks, gown, accompanying some screening teams. We have some screening teams who do home visits and coordinate with the authorities to select some the poorest families and delivers them some financial support and food packages and donation for hospitals equipment. And they have also defined some women's group who reside and located in neighborhood of the community health centers, and their jobs was to tailoring hospital gowns and also packing some juice and foods for hospital staffs and do some active works to improve hospital staff's spiritual and mental health. They also do some follow up for suspected cases of the infected family members to ensure that they don't have a connection with other people in the community and they are safe in their job. Also, the international slogan, "Health a Health Pulse Initiative," it was also dominated in Iran. We first focus on the members of the family who have the most power, mainly in Iran are men, and they have influence on others that they can manage preventive measures, they can encourage others to do some primary care for elders, people and the vulnerable person in a family. And in this regard, we have trained 20 million health messengers who do home visits, and they are located in the nearest health facilities in the country. And also, we have seen in a study that in a place that in cities and in regions that health messenger do some activities instead of health centers, the screening speed was even twice more than other areas. You can see a picture that there are some home visits by the messenger to screen. These are screening things who are doing to screen and home visit. For the risk communication procedure, we have applied two ways. First of all, a special studio and a section of the news has been devoted for the COVID-19, and we have declared officially the burden of the disease, a number of the confirmed new and recovered cases, and also a policymaker and one of the members of the scientific committee to respond to the COVID-19 were invited every night to respond to the communities or questions and discuss with the communities and determine the role and responsibilities of all of the parts of governmental departments. As you can see in this chart, you can see that Iran broadcasting was the main way of risk communication, but the surprising item is Telegram, because Telegram is filtered in Iran and the WhatsApp is the most popular way for communication. But again, you can see that people in Iran tend to use Telegram for communicating with each other because they think that it's more variable and reliable way of communication, although it's filtered. For returning back to the work, we have defined three groups of patients who have asymptomatic patients, mild or moderate patients, and patients with severe symptoms. As you can see, for patients with severe symptoms, after they can return to back after 21 days after the 3 days of the symptoms improve, when after they discharge from the hospital and the symptoms have been improved, again they have to stay at home for 21 days. For the two other group of patients, they have to stay at home after symptom improvement for about 14 days. And this screening pathway is also important in Iran because we have used some hotlines and self-assessment questionnaires that are shared through different communication channels. We first declare ourselves health, and if we are suspected to have some symptoms that should be monitored by by physician or health expert, these people are referred to CHC or community health centers, and after that, if their symptoms are severe, they would be referred to a hospital. But for vulnerable patients that are connected to COVID-19 and some underlying disease, some people who have some underlying disease, they will be referred to a temporary isolation center for a while to be recovered, and after that they are allowed to back to their families. And for the vaccination, it's important to notice that we have a two joint effort by Cuban and Australian company, Family Institute and the Sinogen and Vaccine Institute from Australia. These are registered for in the registry website of the World Health Organization, and the first one who was a joint effort by Cuban or Frameline Institute and Pasteur Institute in Iran are in this third phase. And but the others, for example, Barakat, Razay, and Fakhr, which are devoted for organization of defensive and innovative of research, these are not a joint effort, but these are more trustable for Iranian people because it's these are registered in the international communities, and they accepted this. These are all the important procedure in Iran. I'm going to answer any questions that you have from Iran's procedure in coping with COVID-19. Any questions? I'm ready to answer any questions.
Yes, Doctor. We'll be taking the Q&A at the end of the session. So right now, I request the next distinguished speaker of the day, Dr. Syed Muntasir Mamoon, to address our esteemed participants of the webinar. Dr. Syed Muntasir Mamoon is the Director of Ministry of Foreign Affairs, Bangladesh, and holds a PhD in Regional Economic Integration. He has studied and taught in the University of Oxford on strategy and innovation. He has a 16 years track record of looking after Bangladesh's strategic interests and relationships in the East Asian, South Asian, and Pacific theaters. He has also worked on synthesizing the framework of economy, ecology, and security across several modes of operation for the government while managing high profile client relationships in G2G and private space and promoting public private partnerships. His personal interest rests on designing a grand vision for South Asia over the next couple of decades. His academic interests are in blockchain, fintech, and artificial intelligence. CHD Group is glad to have Dr. Syed Muntasir Mamun to share his insights on how COVID 19 has shaped global diplomacy and health outcomes. Over to you, Doctor.
Thank you very much. I'm sorry that I'm not on video link, but yes, congratulations, because it's the seventh founding anniversary of the CHD Group. And as I was listening to the distinguished panel and also going through the agenda, I was just uh, recapitulating inside my mind how things have changed. And not really how things have changed, but rather how things have remained ever more changeful. And as I was listening to my own introduction, economy, ecology, and security, how these three have become more intertwined with each other and ever more, I was simply getting amazed. Maybe that is the reason I'll not go through my canned speech, which I never had one anyway. But I believe that we have come to an unprecedented term in our evolution as a species, in our evolution as a sovereign order of species, as humans. See, a couple of years before, the neoliberal or liberal, whichever way that you would like to put it, the order of governance of international relations, the 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 way that states, post-Westphalian states, used to operate and interact with each other was almost given. There was some sort of a finality. There was some sort of a finitude, end of history. History was dead. Conflict of civilization was there, of course, but then some sort of a finality had set in. That okay, these are things how things are and how things shall be, and we shall evolve through this way. But if you look at the situation over last 2 years, particularly with regards to the the incidence of COVID-19 and the associated paraphernalia, things have changed to a great degree. And I would be I'd remiss if there's anyone who would say that things have become what they're supposed to become and things will remain as they are today in whichever form they are, and then it'll evolve further from here. I don't think it remains anymore. And that is why today's discussion, particularly the one that I have been assigned with, that how the diplomacy has changed, remains very pertinent and remains an issue to be introspective about, to be to be restful about to some extent, because as a state level practitioner, I would not take it very easy that okay, things are as they're supposed to be and they're very easy, things are okay and everything is under control. I'd, I'd refrain from making a sweeping remark like that. Things are there, there are issues, and there are conflicts of interests, valid interests, and also of interests which relate to survival of humans, of individuals, might I say even nations and nation states, which are at stake. So those are the few words that I have as a practitioner. And may I say that better than ever before, the, the, the tenets of economic survival, progress, growth, development, the tenets of human security, all its many different aspects of human security, including even food security, and the tenets of survival of climate are under adverse changes in climate have become much more accentuated than ever before in the history of our modern human race. I personally don't think that human race was under such kind of acute tensions other than maybe some accentuated one-off times of nuclear tensions before in last 100 years. And that's where diplomacy is. So diplomacy is, of course, is statecraft. It is usually in the modern world, it is usually prescribed and practiced by trained diplomats. But I don't think that diplomacy remains within those confines anymore. Diplomacy has more or less become intertwined and synonymous with politics, and the whole gamut of politics that affect the existence, survival, continuation, and extension of the post Westphalian nation state in whichever form, maybe in all forms. The entire gamut of that politics has become subject matter of diplomacy. As a result, old relationships are being re-examined, reoriented, re-optimized, and new relationships are also being examined and enacted and again, of course, optimized. So history has somehow been reborn. One of my core areas is blockchain, fintech, and ultimately artificial intelligence. One of the core hypotheses that we had um, in the writing was that in exactly 9 to 10 years from today, the AI winter will be finally over, and then there will be a completely new paradigm in the way that human politics, international global politics will operate. So it will be a different one. That's what the hypothesis was. Some say that the current COVID realities have moved the world realities 5 to 10 years ahead. I would not say that. I would say that it's hardly 2 to 3 years, maybe, which we have exceeded. But whatever be the case, whatever was coming, one way or the other, has become more accentuated and more assured that it is coming. And the interesting part is, we don't exactly know what the nature of those outcomes, those events shall be. So, to my understanding, COVID 19 is a wake up call. Of course, it is a humanitarian issue. Of course, it is an area where doctors are involved, which has a it's pandemic situation. Yes, but this pandemic situation, this very much global health hazard, it has pushed the policymakers, the statecraft people, even the individuals, even the nation state as a whole, to think of the whole levels, the entire levels of existence and operation in whichever form they are, to rethink. And that is also related to the way that the global architecture is concerned and is going to be concerned in next 8, 9, 10 years from today. So these are my few musings. We could always keep on discussing about these things, but I look forward to listening more to all the distinguished panelists here, and I see a few names which whom I have read a lot. I have read your works, and I look forward to listening to it. So thank you very much, and congratulations again.
That was really an amazing speech. Thank you, sir, for sharing your great knowledge with us. Our next distinguished speaker for the day is Dr. Ivana Haluskova-Balter. Dr. Balter is an advisor to Association of Southeast Asian Nations. She's a French medical professional specialized in infectious diseases, internal medicine, covering various therapeutic axes, and is certified in immunology, pediatric, MBA vaccinology with years of active clinical practice. She has multi-country medical field experience in Southeast Asia, India in particular, and West, Central, and Eastern Europe. CHD Group is glad to have Dr. Ivana Haluskova-Balter to share her insights on how the European Union will cope in a post-COVID-19 world. Over to you, Doctor.
Yes, can you hear me?
Yes, Doctor, you're audible.
Yes. So thank you for kind invitation, and I was truly amazed about the quality of the speaker and very burning topic you actually included in a program. It's my pleasure to support through years the CHD Group, and I'm very happy also to see the different feedback. I think that we live in very particular period, which it's not only about COVID-19. And the question I was asked to comment how EU is going to cope with the post-COVID world, it's more than actual. But I would correct this from the source. It's not only about EU. I do think that the COVID-19 truly relieved or revealed the importance of the multilateral partnership, collaboration, and truly involvement of the community. I think that it's more than ever showed importance of interdependent world. So I would rephrase
Dr.
it.
Ivana, I'm so sorry to interrupt. Your video is not visible.
Oh, sorry. Can you hear me? Can you see me?
Yes, yes, we can
Great,
see. Thank you.
great. So I was just saying that it's not only about Europe anymore. It's a word that it's very interdependent, actually. So I would say that it's not only EU, which is scope for the post pandemic world. It's now all interconnected, multilateral, open partnership. I do think that the COVID-19 actually revealed importance of united in diversity, of importance to open eyes and to work on the more concrete way how we can improve the links which were established already before COVID. I can give the illustration and come back to initial question. The European Asia Connectivity Strategy was started in 2018, and in 2017, the European Union actually signed the agreement with India. There was events like G20, where we highlighted the importance to work together. And recently, there was also the Belgium meeting focused on Asian countries, again highlighting the importance of cooperation not only in health area, in a research area, in a cultural way, in economic way. But the point is that we drafted a lot of mutual cooperation, but still we were far from the practical implication and from the practical example which we're missing, particularly in the area of the global health. So I would say that now Europe, what I can summarize, we mobilized a lot of resources. We succeed to make states, 27 member states, to mobilize resources to foresee our plan of post-COVID recovery. But it's not only about post-COVID recovery. I think, as was mentioned previously, COVID-19 is actually a wake-up call from many aspects. COVID-19 is not only about sanitary crisis. COVID-19 is about the humanitarian, societal, social, economic, and geopolitical, let's say, wake-up call. I think that it shows us that we can do better tomorrow as we did yesterday. So how the Europe is going to cope? I think that the only way for us, and it was highlighted many times in many meetings, is to open eyes and to try to build the concrete partnership with the Asian countries, with a very concrete example in areas of health, of research communication, of research cooperation, and in economic cooperation, but in a base of mutual respect and mutual trust. I do think, and someone said very nicely, I think it was a Kissinger, he said, the post-COVID world will not be never the same. In addition, I don't know if you have seen the report of the advisory board, intergovernmental board concerning the climate. So I think, summarizing this, the Europe is now going to implement the health and the climate issue. Why? Because I do think that the COVID demonstrates very clearly that it's very important to see impact of the human and our activity on the development and our nature. It's absolutely necessary that we start now, as a first point of learning of this crisis, to work on the preparedness for the next. I mentioned the climate, I mentioned environment. There is a lot of impact, like human activity on the ocean, on the soil. So I think from all these aspects, the first step will be to build the cooperation in a next and better preparedness for tomorrow. Because we have seen the crisis showed not only lack of cooperation or the links were built, but lacking the concrete measure to work together, we saw how important it is also to guarantee the egalities, access to care, and to work and promote health as a major tool in economic sustainable development. So this is not only Europe. I repeat, it's not only Europe is going to cope with the post-COVID world. We have to work jointly. So as said, looking back at this key moment from this crisis, we must learn this lesson, and we must emphasize on reinforcing finances and public support and political support on a health research and medical ecosystem. I think this is one of the key lessons. And this is something which is built in a European plan. It's called Future of the Europe, which is now under consultation of all member states till 2022, where the health, climate, research, in addition to other key topics, are one of the priorities. So this is the open window to build Europe after COVID-19. And very important will be the position of Europe in this geopolitical new context to maintain and build a new relationship within the key areas I mentioned the COVID showed us. So finally, I would say we have seen very clearly that we are facing climate, environmental change. The next pandemic will be coming maybe tomorrow. There is a lot of global health issue like antimicrobial resistance, but which is linked very closely to decreased biodiversity. And we now must think broadly. We must emphasize and underscore important, as I mentioned, of political support to public health and treat and be careful that those needs are addressed and well funded. So this is from my very brief introduction, our talk, and I am very strongly convinced that there is a space to make the agreement which was signed in the past more concrete, particularly in an area of the global health, research cooperation, given the context we have seen of climate environmental factors, where we must be ready together to be better prepared for next pandemics and to guarantee that the public health as a prerequisite of the sustainable development is accessible for all. So thank you for your attention.
Thank you, Dr. Walter, for your word of wisdom. May I now request the next distinguished speaker of the day, Dr. Sloka Iyengar, to address our participants. Dr. Sloka Iyengar is a neuroscientist and global health strategist based in New York. She is a representative at CHD Group USA and also works as a consultant at various public health organizations in India and the US. Her focus areas are mental health, including the use of arts to promote positive mental health, aging, palliative care, and neurological diseases. CHD Group is glad to have Dr. Shloka to share her insights on the impact of COVID-19 in USA and the road ahead for sustainable development. Over to you, Doctor.
Thank you so much, Dr. Demi. It's really a pleasure to be here. Thank you to Dr. Edmund Fernandez, to CHT Group for really convening this amazing meeting of all of us. I would also like to thank my fellow speakers. I've been listening to you and really learning a lot from your areas and from your regions. And then, of course, the audience. Really thank you for being here from wherever you are in the world. I hope you're happy, healthy, and safe. The topic for my talk today is the US impact from COVID-19 and what have we learned on the road ahead for sustainable development. There's so much to talk about, as you can all imagine. The 5 things I'll be talking about are learnings from the COVID-19 pandemic, and you'll see recurring themes from the previous speakers as well. So these themes that I would like to touch on very briefly today are protection of the environment, gender equality, digital transformation, affordable energy and decarbonization, and then what we can do to protect the world's most vulnerable populations. So the first theme is protection of the environment. Chiara mentioned a great deal on this, and I really thank her for her insights as well. And it's not a surprise at all that there is degradation of habitat. There's poor treatment of animals. Zoonotic transfer is a phenomenon that we know has happened for COVID-19. There is a human population that is growing by the day. And then, of course, there is deforestation. And while each of those things would really merit many hours of expertise and experts, what I have tried to do today is take each theme, talk about the scenario, and then talk about solutions that are especially pertinent in the United States. So thinking of environmental protection and some of the things we mentioned, degradation of habitat, deforestation, some of the potential solutions could be to recognize the link between humans, animals, and nature. One Health was mentioned not too long ago. The US could also better regulate the international trade of wildlife and then invest in conservation. And again, each of those topics, can and should really be talked about and discussed for a long time. But in an effort to give sort of a snapshot on the learnings from the COVID-19 pandemic and how these can really pave the way for future thinking. The second one I wanted to discuss was gender equality. The fact that there is gender equality, again, is not a surprise, but it's just something that has been exacerbated by the pandemic. The burden of unpaid care very often falls on women. And of course, this is all over the world, not just in the United States. Women act as caregivers, both inside and outside the house. Many women have had to leave the market because of childcare and caregiving needs. And then there's also traditional mindsets on what women can do, what women should be doing inside and outside the house. And a few solutions to think about are, if we can increase public and private sector funding on education and childcare, to really promote family-friendly policies that prioritize childcare, that really don't penalize women for wanting to have children, for wanting to take care of children, and perhaps even more broad caregiving duties. and then shifts in societal norms on who takes care of the family. Again, these are definitely not some things that can be happening overnight. But if anything, the pandemic has shown how, first of all, how important caregiving and caregiving by women has been, and the gender inequality rather, that has been really come to the forefront due to the pandemic. The third theme I would like to touch on is that of digital transformation. And over the last year and a half, since last March, this conversation is an example of this digital transformation. We have all convened here from all over the world, and we have really seen a high reliance on technology during the pandemic and during the lockdown. We've been using technology for school, for work, for socialization. However, there's also a digital divide, and these are, an inaccessibility to digital technologies for individuals and businesses. And then, of course, with this heightened reliance on technology, there's also the mental health effects of living in a digital world, of perhaps even having a more sedentary lifestyle than we did before COVID-19. So what can we do? Dr. Mamoon mentioned AI. And of course, harnessing technology to develop ways in which AI can aid in disaster response, perhaps even combat air pollution, using technology to better monitor and track processes and their impact on environment. And then, we all have either taken part in or really heard about telemedicine, and build robust telemedicine infrastructure for the hard-to-reach populations. The fourth sort of overlapping theme, again, is affordable energy and decarbonization. And, it's really none of this is surprising, but it's really not a surprise that access to reliable and affordable energy, even now in 2021, is not within reach for everybody. So what can we do? We can incentivize low carbon options and effective supply chains. Thinking and looking at sustainable aviation and fuel use jet fuel use, thinking of what we can do to transition to clean electricity, to reduce transportation emissions, to really think of climate leadership at the federal level. And again, this has been mentioned already by other speakers, but just wanted to uplift these themes as well. And then the last theme I would like to mention is the protection of vulnerable populations. And, over the last year and a half, we've been bombarded with news, news about migrant workers, how, how the COVID-19 pandemic has really exposed gaps in our system and forces us to think of what we can do for these populations. Just a few that come to mind are those with disabilities, those that are undocumented, those that are living in poverty, those that are unfortunately incarcerated, and those that are elderly, perhaps, with disabilities and are living on their own. And what are some of the solutions? Really progressive leadership to provide safety nets for these individuals. And of course, I haven't mentioned all of the vulnerable populations, but really thinking proactively about providing safety nets and thinking of health justice, which is an emerging framework to use law and policy to eliminate unjust health disparities. So in conclusion, again, I would like to thank you for your time. Just go over very briefly the themes that I mentioned: protection of the environment, gender equality, digital transformation, affordable energy, and protecting the world's most vulnerable populations. It is very clear that all of these issues are interconnected. So how we address these issues, our solutions also will have to be interconnected. And then, overarching and perhaps going through all of these themes is that of mental health. Mental health effects of the lockdown, mental health effects that have been felt by vulnerable populations, even being exposed to the news and, seeing images all day long. People that have lost jobs, people that have lost families, and what can we do to proactively think of mental health, positive mental health in these populations, but definitely in everyone. So again, thank you for your time, and I really look forward to listening to everyone else and any questions that you may have. Thank you, Dr. Demi.
Thank you, Dr. Sloka, for sharing a great knowledge with us. Distinguished participants, let us have the pleasure of listening to our next speaker of the day, Dr. Vinit Kaur Ahuja. Dr. Vinit Kaur Ahuja is an occupational health specialist with Unilever Ghana. She is also program manager with Women's World of Health. CHD Group is glad to have Dr. Vinit Kaur Ahuja to share her insights on how Ghana's healthcare needs to align for a post-COVID-19 world. Over to you, Doctor.
Hello, everybody. So I hope I'm visible and visible.
Yes, Doctor, you're visible.
Thank you, Dr. Demi, for having me on this global platform, and congratulations to Dr. Edmund and the whole team of CHD Group for completion of 7 years, fruitful 7 years. And as I was listening to all the speakers there, it's very enthusiastic to listen all the ideas, the innovative ideas, and the strategies that we need to develop in future from speakers all over the world. Now, the COVID-19 pandemic, it has had devastating economic and humanitarian effects worldwide, as political, social, economic, and health systems and networks across the world have been overwhelmed and devastated by the rapid spread of this virus. Now, I would like to quote here some of the findings by Dr. John Kwake. He is a senior economist at the Institute of Economic Affairs, Ghana. And in his paper, he presents some policy initiatives that the IEA, that is the Institute of Economic Affairs, believes are the key for immediate recovery and long-term growth. This paper calls for, number one, scaling up of revenue and allocating it prudently and efficiently, especially in favor of investment spending. Secondly, a complementary role for monetary policy in terms of providing direct support to the economy and financial accommodation to the government. Third, leveraging our national resources to support industrialization in the post-COVID recovery. And next one that he mentioned is very impressive, developing and tapping the potential of agriculture to ensure food security and support the long-term growth. The last he mentioned is promoting industrialization by leveraging our national and agricultural resources to transform the economy. Now, all these points that he mentioned in his paper are true to be trusted, but then these are not only pertinent to Ghana's economy, but I think this is applicable for all the countries world over, and the scenario that we are going through right now, the post-COVID era. Talking about the health system, since I am a part of the healthcare delivery system in Ghana, I would like to give a brief introduction about what is the healthcare delivery system of Ghana and how has it coped up with by recovering through the COVID-19 era, and what all steps have been taken by the Ghana healthcare system with the government, and what all we can do to help ourselves to, as our topic of today's discussion says, reclaim our gains back. So the healthcare delivery in Ghana, it is based on a three-tier system at the primary level, secondary, and at the tertiary level. The primary level, which is delivered by community-based health planning and service compounds, which is commonly known as CHIPS compounds in Ghana, the maternity homes, health centers, and district hospitals. Secondary level is implemented by regional hospitals, and at the tertiary levels, we have the specialists and the teaching hospitals. Now, Ghana has had major strides in improving access to the healthcare in the past decade. The number of doctors and the nurses per population has no doubt increased, and it has also increased the coverage by health facilities and the CHIPS services. In 2003, there was a blessing for the Ghanaian residents on the name of National Health Insurance Scheme, which has created to provide financial access to quality-based healthcare for every resident in Ghana. And it has adopted free maternal care in 2008 and free mental health care in services in 2012. Now, from when I moved from India to Ghana, this was the first thing that attracted me as a provider of the healthcare delivery system. The Ghana Health Service is tasked with establishing effective mechanisms for disease surveillance, prevention, and control nationally, and is right now leading the country's COVID-19 response. Since the detection of the Ghana's first case in March 12, 2020, several strategies have been adopted to control the epidemic. Key among them worth mentioning here, is the 3 T's approach that Ghana adopted, that was testing, tracing, and treatment. No doubt this strategy has increased the number of symptomatic positive cases being diagnosed, but it has also led to somehow an increase in the burden on the treatment facilities, which at that time we couldn't bear. Now, the government has responded comparatively quickly to this global pandemic. On March 17, 2020, it barred the entry of all the travelers. Quarantine measures were taken, mandatory 14-day quarantine for all the travelers, and like the land borders were sealed. The Ghana imposed a 2-week partial lockdown in 2 major metropolitan areas, Accra and Kumasi, which happened to be the most populous in Ghana. And it is worth mentioning here also that the country has been exposed to the epidemics in the recent past, including several cholera outbreaks and a successful effort to prevent the spread of Ebola between 2013 to 16. Now, these 3 years, Ghana has been suffering from Ebola. Then also worth mentioning here is the Zika virus outbreak. This is widely thought to have been the reason that contributed to Ghana's ability to conduct enhanced testing and screening at the points of entry, and has likely sensitized the population also to the severity of the current outbreak. Now, Ghana has made significant efforts, as I already told you, about the guidelines and the policies, about supervision, monitoring, and evaluation, and has also received greater attention on the world platform. Ghana's president, Nana Akufo-Addo, he has announced plans to construct more hospitals, around more than 90 hospitals with 100 bed each. But critics have their own reasoning that from where you will get all the fiscal measures to implement all these measures. That remains a concern. Second point that I would like to mention here is about the adoption of the e-health services by the Ghana healthcare system. Digitalizing health sector is one of the areas where I think that not only Ghana, but like as Dr. Shloka, she just mentioned that about the telemedicine, that worldwide we need a sustainable effort to digitalize the health sector. A number of domestic and pan-African healthcare startups have built on recent innovations to help tackle the new challenges which have been posed up by COVID-19. Although in 2016, the Ministry of Health and Ghana Health Services, in conjunction with the Swiss Novartis Foundation, they had already began setting up a series of teleconsultation centers as a part of its e-health strategy. Perhaps the most famous example of healthcare tech in Ghana is the Silicon Valley company Zipline's use of drones to transport medicine and blood samples. Since the pandemic started, these drones have been carrying samples from suspected COVID-19 patients to laboratories in big cities to speed up the diagnosis and help authorities to keep track of the outbreak. Now, this is a very good example from where we learn how technology has shaken hands with the healthcare delivery system and how we were able to reach to even the remote areas. But again, the economy and the funds and the accessibility of this great facility remains a question, because since it's a private company, what about the adoption of such facilities in the public system? That we need to really look upon as we head in this post-COVID-19 era. Worth mentioning is the emergency response preparedness of the healthcare workers. Now, this has been in question from past many years. And not only in Ghana, but I've seen in many other developing countries that the preparedness of the healthcare workers, especially the emergency response team, that has been a question. And all of us, we stand in the same line as to how we should prepare our healthcare workers every time so that we can tackle such pandemics and such situations, such shocks that the world faces in future. Here in Ghana, the healthcare workers who had undergone training and significantly higher perceived preparedness than those who had not received any training. And this was partly because they felt more knowledgeable about what to do if they had COVID 19 cases. In addition, the communication from the management, having COVID 19 protocols, isolation wards, adequate PPEs, they play an important role in increasing the preparedness. Now, as we are talking about the post-COVID era, we cannot ignore the existence of vaccine, which has been a gift and a blessing for countries worldwide. And at this point, talking about vaccine diplomacy, vaccine nationalism, and vaccine hesitancy is of key importance, as the enrollment and the coverage depends largely on these behaviors. When we talk about vaccine diplomacy, the one thing that comes into my mind is the COVAX program. The swift and the proactive measures that were put in place by Ghana became the recipient of the historic first shipment of COVAX vaccines on 24th February 2021. And this was a historical day in the history of Ghana. Neighboring countries like Ivory Coast, also known as Côte d'Ivoire, this was the second country to receive the free vaccines 2 days after. Now, Ghana has developed the National Development and the Vaccination Plan using the WHO SAID's values framework for the allocation and the prioritization of the COVID 19 vaccine. Key aspects of readiness that form the basis of the NDVP were regulatory preparedness and safety monitoring, planning, and coordination. Now, these remain the areas where we need to be sustainable, where we need to carry these areas forward so that not only the COVID-19 vaccine enrollment, it should fasten up, but all these areas form the basis for any kind of health hazard or biological hazard or any kind of economic hazard that we face in the future. The development systems and the modalities, the immunization monitoring systems, the operational and the surveillance programs, communication, information, the supply chain processes, all of these have been the pillars of Ghana's healthcare delivery system. Now, when we talk about vaccine nationalism, we talk about the countries saving vaccines first for themselves and then helping others. Now, this might be perceived as a selfish measure, that we are saving our country first and then we are helping others. But to some, this might be perceived as an intelligent effort, as an intelligent step. Like in the airlines, we say that first put on your own oxygen face mask, first help yourselves, then you help others. So these areas remain debatable as to what is vaccine diplomacy and nationalism and how these two should be dealt with. Sorry. So when we talk about vaccine hesitancy, the third behavior that I mentioned, there has also been some effort to tackle vaccine hesitancy world over, as we have seen the world leaders stepping ahead and taking the vaccine first themselves, so that the apprehensions about the vaccines are removed from the general public's mind. Now, having said all these things, concludingly, I would like to mention certain points which we should, I think, not only in the Ghana healthcare delivery system, but also world over, if like all of us here via platform, we should ponder over them and think that how they can help us achieve our sustainable development goals, which have been in long standing, and the year 2030 is coming nearer. So the first step that I would like to mention is that while the primary impact of the pandemic in Ghana and in as that matter the other countries is concentrated on the human health and the public health systems, the wide-reaching secondary effects of the virus and the consequent mitigation and preventive measures should be addressed in multidimensional and intersectoral ways. Pandemic response measures provide valuable opportunities for transformation and lasting sustainable improvements in health and economic sectors. Now, certain healthcare strengthening measures like the emergency response preparedness of the healthcare workers, addressing the fiscal gaps in the health sector, equitable distribution and allocation of the resources, updating the existing health infrastructure, thoughtful measures to make services like telemedicine, digitalization of the health services accessible to even the remotest of the country's areas. Sorry. Ensuring the sustainability of the systems is key to dealing with the ongoing pandemic and to prepare for the future shocks, including the climate-related crisis. Integrated multi-sectoral approach which should emphasize the global agenda of health in all the policies. Now we have discussed COVID-19, we have discussed the vaccine, but the pandemic that I think is, in my view, is approaching us, but we are giving a blind eye to that, is the pandemic of the non-communicable diseases, hypertension, diabetes, thyroid diseases. All these were the biggest reason of the COVID deaths worldwide because they were the comorbidities which worsened the situation of the patients who were suffering from COVID-19. Those are the areas where our healthcare leaders should sit and think about the pros and cons of the policies that we are making, and we should really elaborate on all these sectors because because all these measures, they are vital to avoid lamenting on the unfinished agendas, and we have a carry forward to take into 2030. That was all from my side from Ghana, and thank you, Dr. Demi, and thank you, Dr. Edmund, for listening to me on this. Thank you very much.
Thank you, Dr. Ahuja, for your influential message. Now let us have the pleasure of listening to the 8th esteemed speaker of the day, Dr. Kieran Walsh. Dr. Kieran Walsh is Clinical Director at BMJ. CHD Group is glad to have Dr. Kieran Walsh to share his insights on research outcomes, COVID-19 and the BMJ. Over to you, Doctor.
Hello, good afternoon, and a warm welcome to this session from BMJ Best Practice. Kieran Walsh is my name. I'm Clinical Director at BMJ. Thank you very much for inviting me to the 7th Foundation Day Forum of CHD Group, India. I'm going to talk about COVID and clinical decision support from BMJ Best Practice. So how did we get on with COVID-19? Well, in February 2020, we launched a new resource on BMJ Best Practice on COVID-19. And I said a second ago that our content is continually updated. But of course, COVID-19 posed particular challenges. And our topic on COVID-19 has changed every second day for the past year and a half. At some stage last year, it was changing every day because the users expect content that's continually updated. We also try to provide content that's evidence-based, which of course is another challenge in the context of COVID-19. The last time I looked at the resource, it had over 1,000 references. The evidence base is continually changing, and we try and continue to provide the highest levels of evidence, be it randomized controlled trials or meta-analysis or systematic reviews of such trials. Of course, it's also a challenge to make the content accessible, and that means having it on a mobile, on an app, which might be offline, no matter where you are in the hospital or in the community, and even sometimes when you're wearing personal protective equipment. That's what we're trying to achieve. And of course, to try and make resources accessible, ideally you try and have them free. And so our resource on COVID-19 has been freely available since the start of the pandemic. Thank you very much for listening. If you want to find out more, you can contact me on kmwalsh@bmj.com. Let me just share my screen now so I'll be able to show you my email address. So you should be able to see that there now, kmwalsh@bmj.com. We've built the resource with users. So we're delighted to hear from you with further suggestions that you might have, and we promise always to respond to people who contact us. So thank you very much for listening, and I hope you enjoy the rest of the conference.
Thank you, sir, for sharing your great knowledge with us. We have been listening to 8 eminent speakers who deliberated in the areas of reclaiming gains for accelerating global health. All these valuable insights gave us a new perspective in global health. In interest of our speakers, due to the time constraint, we won't be taking any questions. On behalf of CHD Group and our presenters, thank you one and all for your valuable participation in this international webinar. I now hand over to Dr. Edmund Fernandez.
Yeah, I think it was a delight, and thank you to Dr. Demi for moderating the session so very well. I would request our IT team to get all our speakers live if that's possible. I mean, it's been a pleasure. Some of our speakers have left as we have overshot time, but nevertheless, I would like to solicit some final remarks from Chiara, Shloka, Vinit, and Ivana, and if Dr. Fatima is also available. Any final comments, and how do we really shape this working paper which we intend to bring out in the next couple of weeks?
Edmond, can you hear me? I was listening very carefully to the presentation of all. It was very like a puzzle. Everyone brought his insight and experience from the field. And I do think that we should start with the key lines which were highlighted about the importance of the global public health, which is now more than evident. Global public health within the climate, and underline with what you try to do. If I look the representativeness of the people, you have Europe, you have Africa, you have Asia, you have United States. So I think that we should smart, because this was my purpose. I try to illustrate. So try to present global health as a soft power on diplomacy, which can bring the people around. People from the healthcare sector, politician, young supportive politician, and I am sure that I will see you later in the political field, and finance with the private sector. And I'm not speaking just about the pharmaceutical. This should be very narrow. I think that we should think broadly. So I suggest key lines, say, thinking broadly as a wake-up lesson from the COVID-19, bridging all the countries and continents you try to put the representation, and highlight the key, I'll say, message where the partnership we think to bring. So I said climate, global health, multilateralism, region, and what would be the main areas in the global health we should focus. I try to highlight my lesson: preparedness, preparedness, preparedness. But I'm afraid that we need to be prepared for tomorrow. Tomorrow might be Ebola, tomorrow might be dengue, tomorrow might be malaria. We are not ready. Well, those are not transmissible as we see contagious with the COVID-19, but I think preparedness, access, because we'll have the same discussion about the accessibility of vaccine, treatment, healthcare in general as such for all, and building the bridges, supporting the knowledge, building the health capacity within the plan of preparedness, and strengthening healthcare system.
Sorry, I'm not sure if you can hear us.
Sorry?
Can you?
I can hear everything.
So this was my highlight. I said, bridging the people, bridging the countries, private, public sector, and community involvement. Because Edmond, you do a lot of things with the CHD Group around the health, climate, And I think that the message needs to be sent to the people who will be representing countries in Glasgow, because there will be a lot of discussion about the climate environment. And the lesson learned from this experience is truly preparedness, healthcare system capacity, and access of health for all. That's my K-line.
Thank you, Dr. Ivana. Kiara, Shloka, Vinit.
Sorry, we have elections, so I have quite busy day today because there is a lot of discussion. You know that we had GSET. You know that was a great initiative. So Europe is in quite important moment, and I think it's very crucial that we focus the future in Europe on what I was trying to highlight: health as a prerequisite of the sustainable development, accessible for all. Okay.
Thank you, Ivana.
I would just like to, if I may take the floor, I think this is just a spontaneous talk right now. I would just like to highlight how men and women tend to respond differently to potential vaccines, treatments, illness. And so access to sex disaggregated data would be essential to conduct more appropriate clinical studies and also to share standardized data and also understand better how trials and also illness affect differently women and men. So I believe that another point could be understanding sex and gender in relation to global health. That should not be seen as just as an optional add-on, but as a core component of ensuring effective and equitable global health systems. Thank you. Over.
Yes, thank you, Chiara, and thank you everybody for highlighting your points, because all the sectors, like I mentioned, that we need an intersectoral approach to deal with all the problems that we have been facing in this because of the COVID-19 pandemic. So my take on this would be they already mentioned about the preparedness and covering all the financial gaps, the economic sector coming up together, the equitable distribution of the resources, whether they are economic resources, the resources in the healthcare sector, and also not ruling out the possibility of the pandemics that might occur in future. And like I mentioned about the non-communicable diseases, hypertension, diabetes, and all these diseases which might silently affect you. You might not be knowing, but then they worsen the situation when any kind of such hazard comes up. So that would be my take on this. Thank you.
I think in addition to everything that has already been mentioned, the two things I would really like to uplift, and from what I already spoke, was the mental health. And I know I sound like a broken record, but the stigmatization of mental health that has happened already, and this includes mental health for frontline workers, for people who are very intimately involved in treatment and care of patients with COVID-19. But then also for all of us, and what can we do right now to really promote positive mental health? And the second theme of protecting our vulnerable population. So from migrant workers to elderly people to people with disabilities, and what does a proactive infrastructure for protection of these people look like? People that are incarcerated, those that are unfortunately in precarious situations. With that, I would like to thank you, Edmund, for inviting me and inviting all of us for a really amazing conversation.
No, I think it's a pleasure to have each of you here, and look forward to building on our shared understanding to achieve global health targets as we move ahead in time. Thank you very much for sparing your time, and have a nice evening, morning, whatever is applicable ahead. Bye-bye.
Thank you.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.